The spirochete that causes Lyme disease is Borrelia burgdorferi and related Borrelia. The model that I have used to try to understand all of the possible things that Lyme disease can do is the syphilis model. Stokes, Modern Clinical Syphilology, 1945, W.B. Saunders publisher. It gets into every organ system of the body, and there are chapters on manifestations in the skin, manifestations in dead babies, manifestations in the bone, manifestations in the brain, and particularly dementia, because dementia and syphilis was general paresis, and general paresis is as close as you could come to a carbon copy of Alzheimer's disease. The diseases are exactly the same. If a spirochete, syphilis, could cause dementia, why couldn't the Borrelia spirochete, over a long, long, long period of time, cause Alzheimer's disease? I extracted DNA from 10 Alzheimer brains that came from the Harvard University Brain Bank. These are the Harvard brain DNA extracts in this tube. Using molecular methods, I was able to find the DNA of the spirochete, which causes Lyme disease, in 7 out of 10 of the Alzheimer brain specimens that we received from Harvard. That's incredible. The results of the experiment could not have been predicted in anybody's imagination when 7 Alzheimer brains gave me essentially the same thing, which is part spirochetal, part human, linked up in one molecule. I about fell off my chair. If my dream comes true someday, that will redefine the practice of medicine. That will redefine the lives of millions of people. Since spirochetes are the cause of neurodegenerative diseases and syphilis, could it be that this spirochetal infection, Lyme disease, is partly or wholly responsible for some of the neurologic degenerative diseases we face in this century? Alzheimer's, Lou Gehrig's disease, Parkinson's disease, multiple sclerosis. Those are named conditions for which no cause is now known.